an open relationship, understanding of HIV and AIDS issues, importance of knowing one's HIV status, including support for broad-based VCT participation amongst teens and adults, buy-in and support for Lifeline's BCI program approach, and a BCI approach tuned to address local cultural sexual behaviors, encouraging community leaders to take personal action in their group village settings, and identification of over 40 home-based care and BCI volunteers. Trying to change deep-rooted cultural beliefs and value systems that drive sexual behavior is not easy. We found that the most effective ways of getting these difficult yet important messages across was to employ traditional methods of communication: song, dance, and drama. Nelson and Eric mobilized and coached 2 teams of youth volunteers. Key messages about the consequences of current behaviors and choices for positive change are carefully woven into the story of every choir song, traditional dance, and play. As village outreach coverage grew in scope, we held practice sessions to fine-tune individual plays as we see here at the Ngozi Health Center. It also provided a good opportunity to capture a repertoire of plays, choir numbers, and dances on video, which could be replayed on the audio-visual monitors in the waiting areas of the Ngozi Health Center. BCI messages in drama, song, and dance have been received well in weekly village outreaches as the crowds have grown to between 700 and 1,000 regularly at each presentation. Another highly successful method of gathering thousands in the community to hear BCI messages was a football tournament we called the VCT Cup. The halftime show included singing, dances, and testimonials from people living with AIDS in the community going public about their status. Coverage by the national TV station helped to profile Lifeline's work in Salima district through these large-scale events.
matenda amene akunyamula anthu ofunikira kwambiri.
I'm with two of our volunteers, and Esther Pele Camoyo, and you can see we're heading out to treat one patient who is too sick to be able to get into the clinic. So we're going right into his home to assist him. Okay, very typical part of the village here at Chilambula. Alright. So Hassan and Caesar are assisting here. I think watching very carefully, see how things are done. Considerable resources have gone into training up and mobilizing more than 40 home-based care volunteers over the past 18 months. Esther Pele Camoyo gives oversight to these small but effective teams as they overcome barriers of stigma and become the hands extended of health center staff, caring for those patients too sick to leave their homes to seek treatment at the center. Here's our little home-based care kit we put together.
Yeah.
The majority of HBC patients are stage 3 and 4 AIDS sufferers. Access to ARVs have brought significant hope and miraculous improvements to many of these advanced AIDS patients who otherwise have few other options for recovery. They're on their way out to the community. The arrival of donated bicycles that were part of the Canadian iCross container now allows HBC volunteers to reach patients in homes much further away.
This patient is on CTXC and she came for group counseling. She has not yet started this ART. Then we are going to supply her with the ORS and PCM due to her problem of diarrhea and headache.
Here, a home-based care patient was referred back to the senior medical team at the health center. We see Dr. Brooks, Eric, and Violet bring their collective expertise to bear on a young 10-year-old boy who is suffering from paralysis and other complications related to severe tropical ulcers, possibly even TB.
This that looks like a pig. Is he in much pain? And he's got the same mark as it. How long has he had that?
From April this year.
It's all de-sloughing, doesn't it? All this stuff.
Yeah, yeah.
Often you get
It bled me at least.
And then like and then you should have dressings put on it.